review a little bit, just very quickly. So let's see. Last time we talked about global poverty. We talked about the progress that the world is making in global poverty. It's significant progress. We've made a lot of progress since the Industrial Revolution in the early 1800s, and we continue to make progress today. But the problem persists. There's still a lot of people, almost a billion people, in extreme poverty, which is defined by the World Bank as living on less than $3 a day. There's also a lot of people in relative poverty, so people who have more than $3 a day, but still have trouble meeting their basic needs. Uh, and so we said that much work remains to be done, especially in sub-Saharan Africa, but also in Asia and also in South America. And we recapped this idea that there are many problems in the world. The world is awful in many respects, but the world is much better than it used to be. And also, the world can be better in the future because we have positive examples of the world being better. For instance, here, this graph shows a low mortality, child mortality rate in Europe compared to the rest of the world. And so it is possible to improve as we've done in the past. And then we talked about some reasons why poverty persists, governance failures, institutions, climate issues, poor infrastructure. So it's oftentimes not a simple fix that some organization can come in and easily change the conditions. Often this requires a lot of people. Often the local community requires them to shift how they're doing things, right? Instead of just people coming in and changing things around. So it's a hard problem. And nonetheless, organizations like GiveWell and Open Philanthropy are trying to solve the problem by studying what works. We talked about certain things they do, like cash transfers and lead abatement and pandemic prevention, which have long-term effects in reducing poverty. So they're not just reducing poverty in the short term; they're trying to work for the long term. So we talked about direct cash transfers, giving money directly to people. We talked about health interventions like reducing malaria through use of bed nets and deworm the world and vitamin supplementation. And so we talked about how there are many ideas and many good ways that we know of reducing poverty, but still the problem persists, and we're going to need a lot more effort in the future. So today I just want to double click a little bit first on some of the questions that came up last time around metrics. And then there were some other questions as well. And then also I want to talk a little bit about two other issues that are near and dear to effective altruism, and that is climate change or the environment in general, and animal welfare. So first, key metrics. So how does GiveWell evaluate charities? How does EA think about these things, right? So we said that an important part of EA is measuring impact. And instead of just sort of blindly going at things, we have to study what we're doing, what's effective, what works, what doesn't work, and then do more of what works, do less of what doesn't work. So some key metrics include lives saved, right? So how many lives does an intervention save? So this requires a lot of good record keeping, and if you take an intervention like malaria bed nets, which is a very a famous one, GiveWell estimates that it takes about 3,500 to 550 to 5,500 dollars per life saved, right? So for a really good charity, let's say it could take about $4,000 to save one life, which is really good compared to many other interventions, right? I mean, it may sound expensive, um, but it is quite difficult to save lives. So, and then these organizations do it at scale, right? They provide bed nets at scale, and so they can save many lives instead of a single life. So that's a one popular metric. It's relatively easier to study because you don't have to think about the quality of lives. You don't have to do a lot of interviewing or rely on subjective measurements. You can simply count the number of people that um, you know uh, uh, the thing saves, the intervention saves, It's a little trickier than that, right? It's not so obvious how many people were saved. So this requires studies like randomized control trials to see to compare how many people live in a case of a control group versus the case that received the intervention, like the bed nets, right? So it's a little more complicated, but it's probably the easiest to measure. Then there's something called DALYs averted, which DALY stands for disability adjusted life years. This is a measurement that combines the years lost due to premature mortality, so early death caused by some disease or poverty or something, um, and so it combines that and the years lived with a disability. And so it tries to measure the overall disease burden, right? So this is very common in thinking about disease. We want to know how many good years of life are lost thanks to a disease, right? Take a disease like malaria. It kills people oftentimes early in life, and that's a lot of years lost in someone's life. But also, you want to think about um, how many years does one spend with a disability, right? And so we're thinking of certain disabilities that are really hard to live with, that degrade the quality of one's life. So you might say that it's maybe it's worth living in many respects with a disability, but nonetheless, it would be better to live those lives without a disability, right? And it's always questionable what a disability means, but we're more talking about extreme cases where almost everyone would agree it's really hard and not good to live with such a disability. Being sick all the time, having chronic pain, being depressed for a long period of time, this kind of thing. The DALYs averted metric tries to quantify that and reduce the incidence of time spent with a disability. And of course, this is a little bit harder to measure, right? Because it requires more subjective assessment. It requires sort of more judgment calls. But many people think it's an important metric because it's not just thinking about how many lives do we save. It's also bringing into consideration the quality of those lives and trying to reduce essentially disease and disability, which plagues people's lives. So, for instance, a metric might be that it costs about $50 per DALY per disability adjusted life years for a top GiveWell charity, right? And so charities would compete on that metric, and GiveWell would try to fund the one that reduces the most amount of time spent with a disease or the most amount of lives lost thanks to disease. On the flip side, there's a measurement called QALYs, and this measures quality adjusted life years. So this weights life years by the quality of health, and it's used to compare health interventions on a common scale. So it's basically asking like how good is your life, right? And it involves a sort of subjective ranking of that. If you have like a really good life, it's like 100%. And if your life is a little bit worse thanks to a disease or disability or something else, then it's like 80% or lower. And so this metric tries to basically uh, take a given year of your life and assess how good it is and try to maximize the positive lives. Positive it tries to increase the incidence of more happy time spent while alive instead of worse lives. So it's similar to DALYs, but it has a slightly different focus. And then, so overall, the GiveWell and other organizations are going to be looking at cost effectiveness. We talked about this a little bit before, which tries to think, how much resources are we spending on a given intervention, and how much are we getting for that intervention? So, what's the sort of bang for our buck? The ratio of impact, whether that impact is measured in lives saved or DALYs averted or QALYs gained. Per dollar, right? So we want our dollar to go the farthest in having the greatest impact. So that's generally what cost effectiveness means. To study these charities, GiveWell has a very rigorous process, so it's not just like a one and done thing where they ask a couple people what's going on in the charity and they look around a little bit. No, this requires a lot of research, program site visits, financial audits, peer reviews, oftentimes, and ideally randomized control trials, which is the gold standard of um, measurement, right? Of seeing if an intervention works in society, right? It's how drugs are evaluated. Basically, you assign randomly people to a control group where they don't get the drug, they get something similar that maybe tricks them into thinking they've got the drug, versus another group, the experimental group that receives the drug, and so then you compare the outcomes. So you can determine if the drug is effective. Well, just like drugs, we also do these when it comes to any sort of intervention, whether it's lead reduction or malaria bed nets, or education. Um, and this is the gold standard. This is what encourages GiveWell to fund your organization, right? They rely on these randomized control trials and another types of studies that suggest that your organization is very cost effective or not cost effective, which helps them make their determination of whether to fund you and recommend you. Um, so they do detailed modeling of your cost effectiveness. Oftentimes it's not going to be clear. Like they're not just going to say, "Oh, show me your cost effectiveness." Rather, you're gonna show them data about your organization based on your record keeping, and then they're going to try to model your impact in the future, right? So this relies on complex models. You know, it's very detailed analysis that they do. But they also do things more like qualitative assessment instead of quantitative that I was talking about before. So they look at things like track record, room for more funding, the overall quality of the organization, the talent in the organization, how good are people, how trustworthy are they, this kind of thing, right? But the important thing is they don't just rely on that, right? They don't just say, um, you know, uh, how do we like these people running this charity? Do they strike us as impressive people with good track records who are honest and who work very hard? Right, all that is important, but it's not the only piece of information. GiveWell is going to rely heavily on quantitative assessments. How many people have you actually saved? What are your projections? But it's a mix of qualitative and quantitative. And then, for example, in 2025, GiveWell recommended the Malaria Consortium Seasonal Malaria Chemo Prevention Program for its low 3,500 per life saved. That's just an example of how GiveWell recommends charities. Okay, a question came up last time about the Kuznets curve in well, this is actually an idea that is involved in inequality and also in climate change, but it came up in the context of climate change, right? So this is a hypothesized relationship between environmental degradation and per capita income. So the idea here is that as a society grows in terms of economic development, as it industrializes, pollution rises, environmental degradation rises, but then eventually it reaches a peak and declines, right? So in sort of pre-industrial society, a more agrarian society where there's no factories, there's no mass pollution, um, there's no environmental degradation or minimal environmental degradation. But then, as the society builds more factories, builds more industrial capacity, and increases in wealth, there is a rising environmental degradation because there's more pollution from factories, from cars, and things like that. But then eventually it reaches a turning point at the top of this graph here, and then its impact, the degradation on the environment starts to decline. So it and what this is enabled by, it's hypothesized that several things enable this: technological innovation. So wealthier societies can invest in cleaner technologies. We've seen this in the West a lot, but also in China, where societies are investing in things like solar power and nuclear power, which do not pollute the environment, or not nearly as much as traditional sources like fossil fuels, which produce a lot of carbon and also other materials that are bad for the environment. And other things enable this, like regulation. So higher standards, governing bodies like the um, the EU, the EU, or the United States, or China. They have higher standards because people demand cleaner societies. For instance, in Pittsburgh, in the United States, the city used to be overrun by smog and pollution, and people started demanding that the city should be cleaner, right? And so more laws were passed to hold polluters to a higher standard, forcing them to pollute elsewhere or pollute less, right? And this ultimately led to cleaner cities, cleaner air, cleaner water, and so less environmental degradation. So we see as this society grows richer, it has less environmental degradation. For instance, the United States, as I mentioned with Pittsburgh, like it used to have very dirty cities, um, and like really every major city was quite dirty. But now almost all of its cities are some of the cleanest in the world. Yeah, there are other clean cities around the world, but New York is relatively clean. And compared to China, for instance, which is known for its pollution in cities, but that's also improving as China grows richer. Um, but there are some limitations to this model. It's been critiqued in some respects. It may not apply to all pollutants or regions, um, and globalized supply chains can make this analysis more complicated. But um, but it's a general idea that we should take seriously when we're thinking about the long-term future, and as it applies to climate change, to pollution, and also to economic growth and development. Right, it at least suggests a way such that increased development and rising living standards doesn't have to lead to environmental degradation, or it might in the short term, but in the long term, it might be possible to have a cleaner world, even as people are richer. Okay. Relatedly, I thought it would be important to talk a little bit about global population growth. So, um, overall growth, the world population is projected to rise from about 8 billion today to about 10 billion by 2050. This is mainly driven by sub-Saharan Africa and India. So there are some regional variations. Uh, Africa is expected a 79% increase by 2054, reaching 2.2 billion. So the largest population growth is expected in Africa. African countries have the highest birth rates across the world. India is also expected to grow in population, but at decelerating rates. So it's expected to grow, but not as fast as it has been. And then East Asia and the West are expected to have low or falling birth rates. Actually, their birth rates are quite low and have been falling for a while, but this is expected to continue. So in China, for instance, or South Korea, famously low birth rate in South Korea, Europe and North America, they're expected to have low birth rates. And so this has implications for effective altruism. Um, it suggests that it's important to improve living standards, healthcare, and energy access in places where there's going to be many people born, right? Especially in India and Africa, because this is where there's more people that are, we don't want them to be in poverty. We want them to have as high a standard of living as possible. And so it will be important to redirect resources towards these areas. Um, and so it sort of shifts our ideas about sustainable development where it's necessary to put our resources and attention. So this is a graph showing the expected population growth by 2100, right? So that's in 75 years. This graph suggests, you can see in this graph that we see large increases expected in Africa and Asia, not so much in Europe, North America, or South America. So it's mainly likely to come from Africa and Asia, especially India and sub-Saharan Africa. Okay. Um, Lastly, I just want to talk a little bit about two issues that are near and dear to effective altruism. Um, I said last time that global poverty is probably like the main area of focus, or one of the most important ones. But climate change and animal welfare are maybe close seconds and thirds. So climate change, a little bit of background. Human activities have driven about a 1.1 degree Celsius warming since 1850. Um, and current trajectories threaten to breach 1.5 degrees Celsius increase in the global average temperature. And this is fairly this is a strong consensus among scientists. It's possible that the warming we've observed is not due to human activities, but it's very unlikely, given that this phenomenon has been studied and modeled in a detailed way, and it's a large consensus among scientists that human activities have caused an increase in the average temperature. So, what do I mean by human activities? This would be industrial activities, like pollution of greenhouse gases. That's what GHG stands for, especially for carbon dioxide, which scientists thinks causes a greenhouse effect, trapping heat essentially in the environment, in the atmosphere, and heating up the world. So, yeah, this is a graph showing that based on simulated models, um, we'd expect to see we'd expect to see what we have in fact seen in terms of increase in the surface temperature of the globe, um, if we include things like human factors, right? So pollution. If we don't include that in our models, then we don't expect to see such increases, right? Because there's a debate about whether the increase we've seen is sort of natural, not due to human activities, or whether human activities have increased it, the so-called anthropogenic climate change, right? And as I mentioned, it's a strong consensus among scientists that anthropogenic climate change is real, that human activities have contributed to warming the climate, even if they're not the only influence, right? Even if it's also possible that natural effects have contributed to an increase in temperature, right? Because in the past that's been true. The world has gone through different periods of increased heat, of colder temperatures, of ice ages, and things like that, right? So it's important to think critically about these issues. But scientists do believe that humans have contributed. The main body the main international body that has studied this is the IPCC, the International Panel on Climate Change, and they project that average global temperatures are likely to reach or exceed 1.5 degrees Celsius above pre-industrial levels, so like before 1700 or 1800. They project that we're likely to reach this by about 2040 without drastic mitigation. And so they also expect that this will cause more frequent extreme weather, sea level rise, ecosystem disruption, and risks to food security and human health. Right. So you might say, so what if it's a little hotter outside? But the worry is that this could lead to extreme weather events that could cause a lot of deaths and misery. Um, and Yeah, so that's the main concern. So what are the solutions? What are people thinking about this issue? Well, one of the main ideas is that we should transition to renewable sources of energy, like wind and solar, which don't pollute nearly as much. Um, but this requires a lot of money, right, and resources, investment in and changing the grid, changing technology. And so at the moment, fossil fuels remain cheap and reliable in the short term, and so that's why they're attractive, right? And you might think, well, we could totally do away with them, and we should immediately. But it's easier said than done. People rely on energy across the world to have a higher standard of living. Whether it means transportation, infrastructure, healthcare, uh, all of the things in society that contribute to people's standard of living rely on energy, and so sort of an immediate transition would be hard for a lot of people. It would reduce people's standard of living. Unless you can give them something that's just as reliable immediately, asking them to give up cheap and reliable energy is really asking a lot of people to suffer. So it becomes a trade-off. How much should we do that in the short term versus thinking about the long term? And do we think that a sort of immediate transition or a faster transition would be better in the long term in terms of reducing climate change? So energy is important, and it's a question of how fast we can transition to renewable sources like wind and solar, and also nuclear energy that does not pollute greenhouse gases. And so concerns are about like the short term, the long term, and the long term effects of climate change, which again are based on a lot of models, and so there's a lot of uncertainty about the long term, right? So that's another question: how much do we know about the long term future? How much can we rely on our models? So it's a very tricky issue. The last issue I want to talk about relates to your attention. Some of you know this issue very well. It's um, it's animal welfare and specifically factory farming. Every year, about 350 million tons of meat are produced annually, and factory farms raise about over 8 billion land animals each year. And that's just the land animals. There's also water animals like fish that many people believe to be conscious. And so basically, there's tons of suffering associated with factory farming and human control over animals. And this is an enormous problem. It's a very thorny problem, difficult to solve because there's a lot of financial incentives and also just incentives in general. People like eating animals; they like the taste, and we've seen that as countries get richer, they eat more animals. This is sometimes known as the meat eater problem, where bringing more people out of poverty is good for them, obviously, but it may lead to higher animal consumption where these animals are often sourced in factory farms where they're mistreated. They live in terrible conditions. They experience a lot of pain and suffering, and they're subject to disease, right? And so we've seen this, for instance, in China, where more and more people have escaped poverty, especially since the 1980s. But that has led to a dramatic rise in factory farmed meat consumption. So there's another trade off here. Um, over 70% of farmed animals live in intensive confinement with cramped cages or crowded pens, leading to chronic stress and suffering. And if you go back to the original sort of principles I was talking about when it comes to effective altruism, right? It's about caring for animals, right? So there's controversy over whether we should care for them equally, whether they should matter equally as humans. But there's general consensus that they should matter to some degree, right? And also, there's a general consensus that factory farming is not consistent with our giving value to them, our consideration of their interest. There's general consensus that we do need to change our way of interacting with nature. Whether that means totally giving up meat consumption or just eating animals that are not raised in factory farms, animals that are raised that are free range. There's debate about that, but there's a large consensus that factory farming is immoral, and we need to figure out solutions to change that. So there have been some solutions, some progress, like cage-free eggs and some high welfare commitments. Oftentimes, this is driven by market demand. So in richer societies like the United States and Europe, many people are aware of this problem, and if maybe they haven't gone full vegan or vegetarian, but they've demanded higher standards among companies, right? So they've demanded labeling for things like free range, grass fed, pasture raised, cage free, so they can alleviate some of the suffering of animals. Of course, this is not a full solution, right? It has a significant impact, we think, but it doesn't fully solve the problem. There's still tons and tons of suffering, right? And so there are many limitations to this, but it's good to have some incremental improvements. There's also been some laws around this change, especially in the European Union. They have some higher standards, at least compared to the rest of the world, when it comes to animal welfare, although those standards are largely believed to be quite ineffective or insufficient to this issue. And a couple states in the United States have some legislation around this, like California, but overall, it's really lacking, and the conditions remain terrible for billions of animals. So the potential solutions, we're looking at things like plant-based diets that I know Soren is a fan of, and uh, so a lot of people have moved to just eating plants or vegan or vegetarian diets, which reduce the incentive to factory farm animals. So there's been a lot of innovation when it comes to meat substitutes, especially in richer nations. And also, there's been even talk of and some progress on cultured or lab grown meat, where meat is grown from cells without slaughtering animals. So it's so called cruelty free meat. But the problem is it's very expensive right now, and there's a lot of resistance to this kind of thing because people don't see it as natural, and people prefer to eat natural, so called natural. Um, uh, and they're very resistant to this, right? So it's sometimes seen as like the best solution to the problem because it allows people to continue to eat meat, um, but um, but it's a very hard to implement the solution. And that's it. Here are just some resources. I have IPCC here, which is the Climate Change Committee. I have the Good Food Institute, which is looking at cultivated meat and new innovations when it comes to eating meat so that we can try to best solve the so-called meat eater problem. And then a graph here, the Our World in Data's chart on population growth, which is very important to keep in mind when it comes to the long-term future, and then a link on GiveWell and how they evaluate their charities and determine cost effectiveness. So yeah, that's it for today. If you have any questions, I'd love to hear them, and I'd love to chat more.